Hello, I'm Dr. Stephen Bacon, and this is a brief video introducing my workshop on therapeutic wizards and constructed reality. So one of the oldest ideas in teaching therapy is the idea that we should look at the most gifted therapists and figure out what they're doing and how they're achieving the results that they get. And the ones that are really exceptional, we've given some names to. The two most common are super shrink and therapeutic wizard. So almost all of the ways of analyzing the outcomes of these wizards has to do with examining what they're actually doing with clients. So we'll take a noted wizard like, for example, Milton Erickson, and see what he does with various clients, then take another different wizard and see what they do. Try to get the essence of what they're doing and see if there's commonalities across the wizards. Unfortunately, even though this has been tried by quite a few different writers and analysts, we have yet to figure out how to decipher what these wizards are doing sufficiently so that we can actually achieve their results, or in fact, actually get better by studying them. However, in the workshop that we're about to take, we're going to be going at a new approach to this. And in this approach is based on some research that I've done along with certain other people, but I'll just talk about my own contributions. And that is, we've taken a look at the concept of whether therapeutic interventions, psychotherapy techniques, in other words, whether they have inherent power. And that's very important because most therapists and most clients believe they do have inherent power. So they say things like, DBT really helped my borderline tendencies, or parent skills training really helped me be a better parent. So they refer to the content of the intervention they got and give it a lot of credit in terms of the improvement that the client got by going to therapy. Well, when we actually do work on looking at whether the techniques actually have this kind of inherent power, we find some really interesting results. And the way that we look at this is we take a look at two factors. One is therapist experience, and the other one is the presence or absence of therapist training. And the logic is very straightforward. If techniques have inherent power, then people who are trained in techniques should get better outcomes than beginners who barely know any techniques or who are totally untrained. Similarly, more experienced therapists who know more techniques and have practiced them more assiduously should get better results than therapists who don't have the level of experience. Unfortunately, when we look at the outcome literature, where it's very easy to measure, for example, how many years a therapist has been practicing and what level of training, if any, they've had, we find that there is no benefit to experience or to higher levels of training. What that implies, of course, is that techniques have no inherent power. And if we go back to the question about wizards, since we've been looking mostly at what the wizards are doing and trying to, by analyzing what they're doing with the clients, figure out how to get better, when we realize that what they're doing is simply a ritual and not a technique with inherent power, then we recognize that we're never going to figure out how to be a better therapist by simply looking at what techniques the wizards are using. And this opens the door to a whole nother way to analyze how therapeutic wizards get the results that they get. And that's one of the main subjects of the workshop. Thank you very much.